I came out to Kalgoorlie for my graduate program in 2018 and I've stayed ever since. Working here has given me plenty of experience that I would not have had anywhere else.
I really loved it here. I have made some really good friends, some really close friends, and we work together, but then we also socialise together as well. So there's always something to do, I actually met my partner up here, so single ladies, don't give up. It's such a good crowd. There is such good people everywhere. The country life is amazing.
If there's a learning opportunity, then they always try and get me to jump on that opportunity. So there's endless kind of potential for work up here.
It's quite different than what I actually expected, because when you Google it, there's literally nothing on the internet. So I thought it would be like a tiny hospital, but it's actually really busy and I do everything here.
It's great. I've loved every minute of it so far. Sort of that closeness and that connectedness of all the other nurses that I really do feel here.
If I was talking to a nurse who wanted to come to country and work for WAX, I would say don't hesitate, absolutely do it. I wish I'd done it sooner in my career. If you don't want to stay clinical and you want to go management, or you want to be staff development, or you want to I really think that the opportunities are abundant.
We now have newly qualified nurses undertaking an emergency nursing transition program in their first year of practice. We're always teaching, whether you're a new grad or a very experienced nurse that's after that change. Everyone needs to be supported.
I have had an incredible amount of opportunities at Bunbury Hospital in my 3 years. I started off here as a grad, working between surgical and medical. I've now been able to go into a leadership role. I've been able to work in community roles, outpatient. Our team of nurses is second to none. We work really well together. We're incredibly supportive of each other, and I don't think I'd be the nurse I am today if it wasn't for that team.
I came here because I had the opportunity to lead a team. I was offered a CNM position, so I just couldn't say no, and it was a big step up for me. And I had amazing support from all the managers here, the clinical, the John, even the executives, everyone, they accepted me well, and and made my transition a bit more easier.
I think for me, Country Health is incredible. If you ever want connection to your community, I think here has been the epitome for me of real healthcare and how you can make a difference for the community that you serve. The beauty of being a country nurse is you really have to be everything. So you have to be the master of all. If you've only ever worked in a tertiary centre, you need to come to country to see how it's really done.
Since working for WA Country Health, I've worked as a remote area nurse in Barangara community, 450 kilometres east of Carnarvon, and currently manage Coral Bay Nursing Post, Barangara Clinic, and oversee the practice nurse and GP visits to Shark Bay twice a week.
We can see anything from, an unwell child, or a person wanting their general health review or their chronic disease management, and ranging right up into emergency presentations, so your category 1 and 2s that need to be seen immediately and medevaced out. I enjoy it because you get the whole range of age brackets and emergency presentations, so you can start off your emergency career coming out here and learning how to be an emergency nurse.
So I've always really been passionate about emergency nursing, and one of the great things about being in the country was that I was able to almost fast track into ED nursing. I was able to do my graduate program at Narrabeen Hospital and then went straight into working in ED, and I've now been there for 6 years.
Oh my God, it's going to be the most rewarding experience I think I have ever had in my career. And to think you can make a difference to the community here and bring your skills it's my pleasure.
The world's your oyster. If you want an opportunity and you really want to make a difference, this is the place to do it.
Give it a crack. Yeah. Do it. It's the best thing you'll ever do.